very productive, and it was positive, and we got a lot done. I've been talking for a number of days, as have most governors, about testing as the next phase that we have to enter into. We're starting to talk about reopening and planning reopening. Everyone is obviously concerned about how you reopen, and if you reopen in a way that is too rushed and you're not prepared, you could actually see the infection rate go up, which is the last thing that anybody wants. And testing is the best way to inform and educate yourself as you're going through the reopening process. So you can watch not just hospitalizations, which will have that data, but also testing, so you can look at the infection rate across the state and see how the infection rate is increasing. Also testing for employees who want to go back, employers who want to know whether or not the employees are actually negative of the virus. So testing has been a very big task to undertake. There's also been a lot of back and forth between the states, my state included, and the federal government about who does what on testing and who's responsible. I said this morning that I think in many ways people were just talking past each other because the federal government is helping on testing and states are responsible for testing. But testing is a very complicated issue with a lot of levels. So to have real progress, you have to sit down and go through the various steps of testing and actually decide who does what. And that's what we did this afternoon. We agreed that the state government should be responsible for managing the actual tests in their own laboratories. We have about 300 laboratories in the state of New York. We regulate those laboratories. It's up to a state to determine how many tests, where those tests should be done, New York City versus Buffalo versus Long Island, et cetera. The staff to do those tests, how often you do the tests, those should all be state decisions and state responsibilities. The antibody test, which is one of the tests, how do you use those? When? That should all be up to the states. The tracing function, that is the function after testing, that actually traces people who are positive, who did they come in contact with, to isolate them, that's all the state's responsibility. The problem with testing and bringing testing up to scale has been the national manufacturers of the equipment who make the testing kits that they have to send to the state labs so the state labs can actually perform them. Those are done by national manufacturers. And the national manufacturers have said they have a problem with the supply chain to quickly ramp up those tests. They need swabs, they need vials, and they need chemicals, quote unquote, reagents. That is where the federal government can help. States cannot do international supply chains. I guess they could, but not in this time frame, and that's not what we do. And you shouldn't have 50 states competing to do international supply chains. One of my colleagues, Governor Hogan, the chairman of the National Governors Association, who is the governor of Maryland, Republican, good man, he was bringing tests in from South Korea, very creative and proactive on his part, but that's not what states normally do. So let the federal government take responsibility for that federal supply chain for the national manufacturers. And that's what we agreed in this meeting. That is an intelligent division of labor, in my opinion. Let each level of government do what it does best. And it ends this back and forth. What do the states do? What does Washington do? Who's responsible, et cetera. To quantify that situation in the state of New York, we now do on average of about 20,000 tests per day. Our goal, which is very aggressive and ambitious, but set it high and then try, our goal is to double the 20,000 to get to 40,000 tests per day. We'd need several weeks to ramp up to that, but it is a very aggressive goal. That is our current system at maximum. That's our current laboratory system, 7 days a week, 24 hours a day. the maximum our system as it exists can do is that number. So that's our goal, and it was a very productive conversation. And again, that is the biggest single task we have to do that is identifiable from today. And it ends the whole back and forth and the finger pointing in a very fair and smart way. It's a smart resolution. So I feel very good about that. And if we could double our tests, that would be a home run. I mean, that is a really, really big deal. We also talked about funding to the states. The legislation that the Congress passed did not have funding for the states. It passed additional money for small business, and that's great, and we need that, and that's a positive. But it did not fund state governments, which to me is just a mistake, frankly. Fund small businesses, fund airlines, but you don't fund police, you don't fund fire, you don't fund healthcare workers, you don't fund teachers, you don't fund schools, you cut the aid to schools in this state. You know the state governments are broke, to use a very blunt term, and you know the state governments are now responsible for the reopening, and the governors are going to do the reopening, and they have no funds to do it. So we talked about that. The president said he understood the issue and that he would work very hard to get funding for the states in the next piece of legislation that passes, and we hope there is another piece of legislation. I also told the president from a parochial point of view, we had a conversation with Secretary Mnuchin and the president that there is a match, what's called the local match for FEMA funding. When the FEMA does something, the local government should match that funding by 25%. I said to the president, there is no way New York can pay that match because we don't have the funding, period. And it is disproportionate to New York because we've had such a much larger number of cases than any other state in the United States that it falls disproportionately on New York, which disproportionately is dealing with this crisis in the first place. We get all the hardship, and then we get a bill because we had the hardship. Makes absolutely no sense. And as a practical matter, we couldn't pay it anyway. The president said he understood and that he would work to waive the local match. Secretary Mnuchin said he understood. Secretary Mnuchin was very supportive. And I thank him for his support. And the president said that he understood and that he would take care of it. And I believe that he will, because he did understand it. And that's a big deal for the state of New York. Again, the incongruity, the state that had the most pain and death should get a bill because they endured pain and death. I mean, it makes no sense. So that was a lot, and it was complicated, but vitally important. And the resolution was good across the board. We met not just with the president, but with members of his team, because a lot of this is granular and detailed, and if you don't work out the details, there is no conceptual agreement, right? It has to be on the details so people actually know what we're agreeing to, and it was on that level. So I thank all the people on the president's team who made themselves available and worked this through with us in detail, and it's a really positive resolution. Any questions?
So Governor, did you get any commitment on either testing or aid, or no?
Yes.
What was that?
Commitment is to attempt and make all efforts to double the number of tests that the state is taking from 20,000 to 40,000. The federal government will work on the supply of tests and reagents from the national manufacturers. They'll take that half of the equation. We will take the half of the equation that is working with the labs in the state and getting them to perform the tests, but we need the test kits from the manufacturers. National manufacturers need the supply chain. That's what the federal government will be doing. We'll be working with the labs to actually get the test takers, go out, take the test, and run those tests in the labs.
And how soon can we expect those tests to come to New York, and how much will that cost?
It will take several weeks at best This is an enormous undertaking to go from 20 to 40. Remember, has taken us over 1 month to get to where we are today, which is on the average of 20,000 tests per day, which is the highest single amount in the United States of America of any state, which is a higher per capita testing rate than any country on the globe, right? So we take 20 per day, which is already an enormously high number, and now we want to double that number. So it's just, in some ways, an outrageous goal, but this is New York, and we're accustomed to outrageous goals. So it's 40. Federal government will take their piece, which is the supply chain for the national manufacturers, reagents, testing kits. We'll take the 300 labs and coordinating that. Again, it took us 1 month to get to the 20,000, which is an extraordinarily high number. Think about it, 20,000 tests per day. That's a system that never existed before. There was no such thing as a COVID test operation before today, before this situation. The price tag, it will be expensive. We don't have a price tag. We're working on estimates. And remember, after the testing, then you move to tracing, which is a whole different operation of people who trace every positive case. So if you have 20,000 tests per day, let's say the positive is 30%, just for kicks. That's 6,000 people per day who test positive, and you then have to trace every one of those people to find out who they were in contact with, who did they go to dinner with, who did they in direct contact with that they might have infected. That operation is going to be enormous.
Considering that the state has already done so many diagnostic tests, seem to kind of be doing 20,000 a year, why the emphasis on that and not on antibody tests?
Both.
Both
Tests. We have to do both, antibody tests and diagnostic testing.
Both of those will get up to 40,000 a day?
Yes.
By when?
We don't know. It's never been done before. So we said, we're working 7 days a week, 24 hours a day, but you have to assume a few weeks to ramp it up. We got to 20,000 over 5 weeks.
But just of the diagnostic, not necessarily.
Just of the diagnostic. Now you want to double that. We need a supply chain for the national manufacturers, which the federal government has to work on, which is an international supply chain to get these chemicals, et cetera. And then we have to get the labs to double their capacity and to have test takers out there to supply the labs with 40,000 tests per day. I mean, it's an enormous undertaking.
But just to be absolutely certain, you got a commitment from President Trump to try to get to 40,000 antibody tests per day in the state of New York.
40,000 diagnostic and antibody.
Combined?
Total. Yes.
And did the president shed any light on how exactly he'll do that? If it's a matter of the Defense Production Act, if it's a matter of working, overseas?
We did not work through, we didn't talk through how he's going to do his end of the operation, but we didn't talk about how I was going to do my end of the operation either. Remember the antibody tests. The question is, what is the purpose of the antibody tests, right? And it's a different conversation, a long conversation. We're now doing the largest antibody survey in the nation. It's going on now. We'll have the results in the next couple of days. What the antibody test winds up telling you, Jesse, is this is the percentage of people who were infected. It could be useful as a data point. This is the percentage of people who were infected and recovered in New York City, in Albany, in Buffalo, et cetera. That could be helpful as a data point. It would also give you a real idea of the mortality of this disease. We know how many people died. We don't know the denominator. We don't know how many people actually had the virus. We know how many people walked into a hospital, but that is very different than how many people had the virus. The antibody test survey will give you the denominator. This is how many people had the virus. 5%, 10% of the entire population. So that's a good data point. It will then tell you people who can donate their blood for convalescent plasma, which is also good. We find out you have antibodies, it could also then instruct you as to who had the disease and can go to work. But let's say a very high number, let's say 10% of the population, you find with an antibody test had the coronavirus. Okay, that's 1.9 million people out of a population of 19, if you tested everybody. What do you really do with that on a practical level? You know, so that's what we have to figure out.
So just, I'm sorry to be dense, but just in this cohort of 40,000 tests per day, how many of those would be diagnostic versus antibody?
We have to determine that.
Would the emphasis be on diagnostic or on antibody?
I think it would be on diagnostic, but it's a conversation that we have to have. How do you want to use the diagnostic? How do you want to use the antibody tests?
And that would be statewide, I assume?
Yes.
Governor, do you have any concerns about antibody testing when it comes to?
People who are showing
Let's not speak over each other if we can avoid it, and I'll answer your question as soon as I finish with the gentleman.
Are these tests going to be for people who are showing symptoms or come in contact with people who have been positive?
It would be all across the board, right? We have some special populations that we want to get done, nursing homes, nursing homes, nursing homes, nursing homes. You have prisons, you have congregate facilities. You then want testing to find out what is the rate of increase of the virus. You're talking about reopening and opening the valve and letting the water flow, watching the meter. This is how you watch the meter. What is happening to my infection rate? So it's across the board testing. And then, as Jesse was bringing up, part of it is diagnostic, part of it is antibody testing. What is the purpose of each different type of test, and how many do you want of each? Mr. Marie?
Do you have any concerns about antibody testing? I know the WHO said earlier this week that there's no evidence that it can work to show immunity.
That's one of the problems with antibody testing. And what is the precision of the antibody test? Some people have questioned the reliability of antibody tests. Some people have questioned the usefulness of antibody tests. And then some health officials, I don't know if it was the WHO, said, by the way, just because you have the antibodies doesn't really mean you're immune from catching the disease again, which is opposite an assumption that we had started with. Wouldn't be the first time we did a 180-degree flip on what we heard. But if that's true, then what is the point of finding out why a person had antibodies, except to know what the rate of spread was?
Can you explain how your regional reopening would work? When Mayor Bill de Blasio last month tried to issue a shelter-in-place in New York City, you had warned that if you shelter-in-place in New York, people would just go to Rockland or Nassau County if they were open.
Yeah.
How would this be different from that?
What, a reopening?
Yeah.
The reopening has to be on a geographic footprint that is workable. Downstate New York, you talk about New York City, Nassau, Suffolk, Westchester. You make a decision anywhere in that region that's not coordinated, you'll just see people move back and forth. You open a beach in Nassau, you don't open beaches anywhere else, you'll flood Nassau County beaches. If you were to close parks in one area, open parks in another area, you just see people get in a car and drive. It's harder to do that when you operate in a coordinated way. And that's why I've said 187 times to my colleagues in local government, there can't be any local decisions because they're all interconnected with everyone else. And that's also the state of the law, which says this is an emergency, the state is coordinating all decisions.
So how would that work for regions, though? If you live in Western New York, what's stopping you from, and it's closed down, let's say, why can't anyone just now drive to Central New York if they wanted to go shopping or vacationing?
Yeah, but that would be a real question. How would you do that? And what would you open in one region which wouldn't cause people to flood that region? That's why it all has to be coordinated. Ideally, look, the way we shut it down was simple. One switch, everything off, right? It wasn't the most sophisticated approach, but it was an emergency, one switch, everything off. Okay, so we understand how it works on a close down. How do you open it up? And how do you take into consideration the fact that Western New York, North Country, Central New York may have a totally different situation? I mean, look what you have with the states now. You have states saying, I can reopen because I don't have the problem that New York has or California has or Michigan has. I just have a different situation. I know I'm a state in the United States, but I have a totally different situation. That's true. I have regions in this state that have a totally different situation. Go ask people in the North Country. They'll say, we don't have this problem. Why are we closed down? But flip side, your point, Josefa, you open up one region, they may be opening themselves up to a problem they didn't even understand. So that all has to be coordinated. No one has been here before, so no one can tell you, don't worry, I have the answer. But think, and let's be as smart as we can in making these decisions.
Governor, you just said yesterday that there could be possible 20% cuts pretty much across the board if there wasn't relief in this next federal stimulus bill. Now that it's not there, when will the state kind of run out of money, I guess? And is that?
Well, you're going to see, we'll do a financial projection in a few days that says we're going to have to make significant cuts to the budget because we were all depending on federal funding. You have to remember, to the extent I seem frustrated about this, you know why? Because I'm frustrated about this. We did the budget April 1. We've been having conversations since this started with the federal government. Don't worry, we're going to fund the state. Don't worry, we're going to fund the state. Don't worry, we're going to fund the state. 2 weeks ago, don't worry, this time we're really going to fund the state. Don't worry, the next bill. Zero. Promise, 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 promise. Zero. Nada, nilch, nothing. Zero. And now we're in a position where we have to do a financial forecast, and we have to tell school districts, you should expect a significant cut. Now, today, again, the federal representatives say, don't worry, next bill is going to have state funding. See, it's not politically sexy for them to fund the state, right? When they can do funding where they can go hand it out to individuals and call them up and say, I got you money, here it is, that is more politically appealing. You give funding to a state, who do you call to say thank? Who even knows? Nobody. It's just giving money to another government, right? So I get why the Senate does what they do. I get that the Senate also represents many states where this is not as big a problem, the federal Senate. You look at the map, you look at the states that are talking about reopening, they don't have the same type of problem we do. I get it. But, I'm the governor of New York, and the senators from New York should represent New York. So, well, don't worry next time. I can't do a budget on don't worry next time, especially after that promise has been made and repeatedly broken, right?
What about
I'm sorry,
the
go ahead,
USS
Jesse.
Comfort? Whose decision was that to send that back? And also, was it a good idea to have the ship come? I mean, I'm looking at numbers from yesterday morning as of 8 a.m., so a little dated, but said the cumulative total intake was 172 patients, discharge was 107, the capacity for the ship was 500, and that was brought down from the 1,000.
Yeah.
So whose decision, was it yours or President Trump's to bring that ship back? And again, was it worth it to have it?
Bernadette, was it worth it to have the Comfort here? It helped 172 people. If you're one of those 172 people, and that ship may have saved your life, they would say you're darn right. It was worth it. 172 people is nothing to be trifled with, right? And also, if you want to look at numbers, look at the projection rates we were dealing with. Monday morning quarterbacking is what we sort of do as a pastime. Look at what the facts were at the time. Look at the numbers at the time. Look at the projections that we were dealing with at the time. CDC says in March, you may need a minimum of 2 million hospital beds in the nation. Minimum. You know how many 2 million beds are? Double the national capacity. That's their minimum. That means in New York, we have 50,000 beds. We would need 100. You can't make 50,000 beds that fast. And it's not just the CDC. CDC, White House Coronavirus Task Force, Columbia University study, McKinsey study, Cornell Weil study. I mean, like every expert said, this is what you need. We worked for weeks, day and night, to get a 50,000 capacity hospital system up to about 90,000 beds. We never made the projection. We never made it. Even with everything we did, even with Javits, even with the U.S. Navy ship Comfort, we still didn't make the projection that every expert had said you would need. Think about that. Thank God, New Yorkers listened, and the projection turned out to be incorrect because we reduced the spread of the virus with the closings, New York pause, et cetera. Okay, so now the actuality is less than the projection. Did you need the beds? Yes, you needed the beds because that was the projection. And even with the reduced number, 172 people were in the Comfort. And I believe the Comfort not only brought comfort, but saved lives. Javits, 2,500 beds. 1,200 people were in the Javits. 1,200 human beings with families who received extraordinary care because the U.S. Army Corps of Engineers killed themselves and built it, and because you had heroic doctors and military doctors and staff who staffed it. 1,200 lives. You know, at one time, 1,200 lives were respected and meant something, and 172 lives meant something. To me, they still do. I know we've lost a lot of people, but every number is a person and a family, a brother, a sister. So yeah, 172 people count.
Did you discuss, did you,
Take one more. Oh, I'm sorry. The topic of the ship came up. I agreed, we all agreed that at this current rate, we don't need the Comfort anymore, and wherever they could use it, because you do have other places in the country that are now coming up to their curve. So whoever needs it, they should have it. We sent 400 ventilators to Massachusetts. People helped us when we needed it. Somebody else needs the Comfort. God bless, we're okay. Yes.
Did you discuss hydroxychloroquine
No.
treatments with the
No.
president? What did you make of the reports today out of veterans hospitals that it was not effective? You had said before that there was some anecdotal evidence that was
I'll tell you the
effective in
truth,
New York.
Jesse, I haven't even looked at them. I haven't even gone through them. I've been running all day.
Do you have any indication of what the state results have been? You said that they were being sent to Washington yesterday.
I do not know. I do not know.
Temporary hospitals that the state geared up for, what happens to those at this rate?
Which ones?
So I guess the Brooklyn cruise terminal. all
We
those-
stopped any new construction when we saw the rate starting to stabilize, but I'm not ready to close anything down yet either, you know? And look, now you have some health experts, CDC today starts to warn about an outbreak in the fall. I mean, I don't even want to think about that yet, but, you know, this is no time to pop the champagne bottles, right? I said a couple of days ago, don't get cocky, don't get arrogant. Anything I didn't say, anything I misstated factually? Okay, thank you, guys. Nursing homes are private. We ask them for the information. They're held liable for the veracity of the information they send. But again, we don't run specifically the nursing homes, so all we're doing is reporting private information, private nursing home information they send to us, we give to you.
Are you worried about inspections in nursing homes? 'Cause the state
Yes,
does
we're
that.
going to have something to say on that tomorrow. Thank you, guys.